Today we are going to see the osteology of humerus. Humerus is the vertical bone situated in the arm. It is the largest and longest bone of the upper extremity. Being a long bone, it has got an upper end, lower end, and a shaft. What are the features on the upper end? The upper end of the humerus has got a rounded head and two tubercles. There is a greater tubercle laterally and lesser tubercle medially, separated by intertubercular sulcus. It is also known as the bicipital groove, through which the tendon of biceps passes. And separating these tubercles from the head, rounded head, there is an area. This area is known as the anatomical neck of the humerus. And we have the shaft. The whole of the upper end is separated from the shaft. That junction is known as the surgical neck of the humerus. This surgical neck of the humerus is related to the axillary nerve. So here is the lower end. The lower end of the humerus has got medial and lateral epicondyles. So here we have the medial epicondyle and this is the lateral epicondyle. Then we have a pulley shaped trochlea and a rounded capitulum. Rounded capitulum laterally and pulley shaped trochlea medially. The rounded capitulum articulates with the radius and the trochlea articulates with the ulna. Above the radius, there is a small depression called radial fossa, and above the trochlea, there is the coronoid fossa. Above the lateral epicondyle, the lateral border is so sharp, which is known as the lateral supracondylar ridge. The same way, medially, we have the medial supracondylar ridge. And this is the shaft of the humerus. Now, let us see how to identify the side of the humerus. Now you know the upper end and lower end. Okay, the rounded head of the upper end directed medially and forwards. Then search for the greater tubercle, which is directed laterally, lesser tubercle directed medially. Then the capitulum, rounded capitulum is on the lateral aspect and pulley shaped trochlea medially, and anterior aspect of the lower end of the humerus. Above the capitulum we have this radial fossa, and above the trochlea we have the coronoid fossa. And if we see posterior aspect of the lower end, there is a single depression, deep depression, that is known as the olecranon fossa. Olecranon fossa. Okay, so how to identify the site? The head is directed medially, greater tubercle is directed laterally, lesser tubercle medially, capitulum is on the lateral part, and the trochlea is medially. And posterior aspect of the lower end, there is a deep depression called olecranon fossa. Upper end of the humerus, we have a rounded head. This rounded head is articulated with the glenoid cavity of the scapula to form the shoulder joint. And adjacent to this head, we have an anatomical neck, and this anatomical neck gives attachment to the capsular ligament of the shoulder joint. When the shoulder joint is formed in this way, so we have the capsular ligament connecting this one. The lateral part of the capsular ligament is attached to the anatomical neck. Then I already mentioned about the surgical neck. Why it is called surgical neck? The axillary nerve and posterior circumflex humeral vessels are related to the surgical neck of the humerus. Above the surgical neck, we have the morphological neck. Now, so here we have the greater tubercle. The greater tubercle has got three impressions. We have upper impression, middle impression, and lower impression. The greater tubercle has got three impressions: upper, middle, and lower. These three impressions gives attachment to three muscles: supraspinatus, infraspinatus, and teres minor. So we call sit muscles, SIT, sit muscles on the greater tubercle. So we have supraspinatus, infraspinatus, and teres minor. And the lesser tubercle gives insertion to the subscapularis muscle. Subscapularis muscle is inserted onto the lesser tubercle. Then I told you the intertubercular sulcus between the greater tubercle and lesser tubercle. It is also known as the bicipital groove because the tendon of the biceps passes through this one. And this intertubercular sulcus has got a lateral lip, medial lip, intermediate area. It has got a lateral lip, medial lip, and an intermediate area. The lateral lip gives insertion to pectoralis major, and the medial lip gives insertion to teres major, and in between, the area in between gives insertion to latissimus dorsi. To remember this one, so we say lady between two major, lady L for latissimus dorsi between two major, pectoralis major laterally and teres major medially. Now let us see the shaft. The shaft has got three borders. There is an anterior border, lateral border, and medial border. Lateral lip of intertubercular sulcus continues as the anterior border. Medial lip continues as the medial border, and we have a lateral border. Lateral border is prominent only at the lower end of the humerus. So we have anterior border. Lateral lip continues as anterior border, medial lip continues as a medial border, and we have a lateral border which is prominent only at the lower part of the humerus. And we have some surfaces between the anterior border and medial border. We have a surface called anteromedial surface. So this is the anteromedial surface of the humerus. Between the anterior border and lateral border, we have anterolateral surface of the humerus, and between the lateral border and medial border, we have posterior surface. We have posterior surface. The lateral border continues downwards as the lateral supracondylar line or lateral supracondylar ridge, and the medial border continues as medial supracondylar ridge. This lateral supracondylar ridge gives attachment to two muscles. Its upper two-third gives origin to the brachioradialis, and the lower one-third gives origin to extensor carpi radialis. Upper two-third gives origin to brachioradialis muscle, and lower one-third gives origin to extensor carpi radialis longus. Middle of the medial border gives insertion to coracobrachialis. Middle of the medial border of the humerus gives insertion to coracobrachialis. And at the lower part, we have medial supracondylar ridge. Whole extent of the medial supracondylar ridge gives attachment to the medial intermuscular septum, and its lower part gives origin to pronator teres muscle. Humeral head of pronator teres. The anterolateral surface of the humerus, there is a V-shaped tuberosity called deltoid tuberosity. Deltoid tuberosity, and the deltoid muscle is inserted onto the deltoid tuberosity. So here you can see the deltoid tuberosity. It has got an posterior limb and an anterior limb. So to this one, we have the deltoid muscle is inserted. Just behind the posterior limb of the deltoid tuberosity, there is a spiral groove. Radial nerve is passing through the spiral groove. That is why the spiral groove is also known as the radial groove. Radial nerve along with the profunda brachii vessels are passing through this radial groove. The area above the radial groove. So we have the radial groove here. Area above the radial groove, the lateral head of triceps brachii muscle takes origin, and area below the radial groove gives origin to the medial head of triceps. Anteromedial and anterolateral surface of the lower end of the humerus gives origin to brachialis muscle. So brachialis muscle takes origin from the anteromedial and anterolateral surface of the lower part of the shaft of humerus. Now let us see the lower end. Lower end of the humerus is expanded, forming the lateral and medial epicondyles. Then I already mentioned about we have a capitulum laterally, then we have a trochlea. Above the capitulum we have the radial fossa. Above the trochlea we have the coronal fossa. Capitulum is a rounded projection antero-inferiorly. It is articulated with the head of the radius. So here I am having the radius. So this is the radius I am having. So this is the head of the radius. The capitulum is articulated with the head of the radius. Head of the radius forming the humeroradial joint. Humeroradial joint. And above the capitulum, we know there is a small depression that is known as a radial fossa. Radial fossa. So here we have the radial fossa. And what is the function of the radial fossa? So the radial fossa lodges the head of the radius during full flexion. So this is how the flexion happens. So this is the flexion, and during the later stage of flexion, the radial fossa lodges the head of the radius, lodges the head of the radius. And medially we have a pulley shaped trochlea. Trochlea is articulated with the end of the ulna. This is how it is. Okay, trochlea is articulated with the upper end of the ulna, and above the trochlea we have a coronoid fossa. Coronoid fossa lodges the coronoid process of the ulna. This is the coronoid process of the ulna. Okay, so this coronoid process of ulna is lodged into the coronoid fossa during the full flexion. This is how it is. See, this is how it is. Okay, it is getting loads over there. Okay, then if you see the trochlea, it's a pulley shaped trochlea. It has got two margins. You can see the lateral margin and the medial margin, and the medial flange of the trochlea. Okay, you can see this is a medial flange of the trochlea. Medial flange of the trochlea projects 6 mm lower than the lateral one. This is the lateral flange and this is a medial flange. You can clearly see that this medial flange of the trochlea projects 6 mm downwards than the lateral flange. So this is a reason for the carrying angle. Then we have the medial epicondyle and lateral epicondyle. So these are medial epicondyle is subcutaneous. Anterior surface of the medial epicondyle, there arises the common flexor muscles. Muscles of the front of the forearm are the common flexor muscles. The common flexor muscles takes origin from the anterior surface of the medial epicondyle, and ulnar collateral ligament of the elbow joint is attached to the tip of the medial epicondyle. Then again we have the lateral epicondyle. Lateral epicondyle is smaller when compared to the medial epicondyle. The anterolateral part of this lateral epicondyle provides attachment to the origin to common extensor origin, common extensor muscle. So this is the common flexor origin, and here we have the common extensor origin. From the posterior surface of the lateral epicondyle, there is a small muscle takes origin that is known as the anconeus, and radial collateral ligament is attached to the apex of the lateral epicondyle. And one more point, if we see the posterior aspect of the medial epicondyle, a nerve is related, that is ulnar nerve is related. Okay, ulnar nerve is related onto. So here we have the ulnar nerve. Ulnar nerve is closely related to the posterior aspect of the medial epicondyle. Then at the posterior aspect of the lower end of the humerus, we have a deep depression that is known as olecranon fossa. The upper end of ulna, we have the coronoid process and olecranon process. Olecranon process of the ulna fits into the olecranon fossa. So this is how it is. See, this is how it is articulated. Okay.